Hi everyone, my name is Dr. Andrew Park. I'm a board-certified pain management physician. Today we're going to talk about epidural steroid injection, which is one of the most commonly done procedure in pain management. Epidural space is a space in the spine which encases your nerves underneath the bones called the lamina here. What gets often confusing is a lot of the women have epidural anesthesia during their labor. It's not the type of the injection, it just refers to the space in the spine. There are a few types of epidural steroid injection depending on the approach that we take. We will talk about 3 different types of epidural steroid injection. One is called the transforaminal epidural steroid injection. And as you can see on the spine model here, there's a hole coming from the side where your nerve root comes out. And when the needle comes into that side, you'll frame it, and the injection is performed. It's called the transforaminal epidural steroid injection. If you see from the back side, there's the area between the lamina here, and we go through the back door approach, and we call this interlaminar epidural steroid injection. Last approach is coming from your tailbone, and it's called a caudal epidural steroid injection, and we approach it through your tailbone area and inject the medication. So how do we decide on which approach of epidural injection to do? Most likely when you first come to see me, we will recommend the transforaminal epidural steroid injection. One of the main reasons we do a transforaminal epidural steroid injection or the selective nerve root block is to confirm a diagnosis or answer a question about a diagnosis. For instance, if you have a L4 radiculopathy, meaning a problem with the L4 nerve root, I will inject the epidural at the L4 nerve. We use local anesthetic for the diagnostic part. The local anesthetic will only last a few hours and maybe even up to the following day. That wears off, and then the steroid kicks in, giving you the therapeutic benefit. If your pain goes away almost immediately that day, within 30 minutes to an hour, the local anesthetic should kick in and numb that nerve, and if your pain goes away, that gives us a clue that our presumed diagnosis is correct. If it doesn't happen, then diagnostically, it is hard to determine from that injection whether the area of injection is the problem or the pain generator or not. Sometimes if you have a severe pinching or pathology, even with the local anesthetic injection, you may not get a good relief. However, in general, the local anesthetic will do a good job in determining the area of the pain and therefore a diagnostic value. When we do a interlaminar epidural steroid injection, it usually means we already know what your problem is, or your problem is too diffuse that we recommend coming from the interlaminar approach, and it spreads up and down the spine in few segments to give you a multi-level therapeutic benefit. However, it is not really a diagnostic injection. Caudal epidural is similar to the interlaminar approach in the sense that it spreads up and down. We often choose this if you already had surgery down in the area where we intend to inject. However, we cannot approach it due to the surgery and scars, then we will approach it through the tailbone. For interlaminar and caudal epidural steroid injection, it is not really a diagnostic injection. However, I do mix in local anesthetic along with the steroid and the normal saline to give a good volume of injection to let it spread up and down to treat multiple levels. In this case, you will still have a good relief, hopefully starting the first day due to the local anesthetic. However, that wears off within a day. And then it may take up to 14 days even for the steroid effect to kick in and give you the therapeutic benefit. So what gets injected in an epidural steroid injection? As the name implies, obviously the steroid is one of the main ingredients. I also inject a local anesthetic, which is a numbing agent, and sometimes I also mix in a normal saline, which is basically a volume expander to make it spread. There is one more medication that is used all the time with epidural steroid injection, and that is the iodine contrast. It is a medication that people have the most allergic reaction to, and this is a medication that you should know about because of this reason. When we say allergic reaction, there is a whole spectrum of reaction, starting from most mild reaction including itching, hives, to most severe form of allergies called anaphylaxis, where your blood pressure tanks, you are going into a shock and needs immediate emergency treatments. Usually a mild reaction is not of concern. However, if you do have a history of severe allergies such as anaphylaxis or having a hard time breathing, shortness of breath, then you should always let us know so that we avoid using this during your injection. So one of the most common questions I receive is how long do these injections last? The answer that I normally give is that I don't know. It is interesting how patients respond to these injections. Some people get the injection once and they are good for many years, and that's on the luckier side. And there's a whole spectrum where it works for a few months, a few weeks, a few days, not at all. And really, we don't know until we actually do the injection to determine how long it will last for you. There's multiple factors that go into it, and the severity of the pathology also plays a role, but not necessarily only.
100% correlation between the pathology and how well or how long the treatment lasts.